Hi everybody, this is Jonathan. I'm going to discuss toothache, and I'm telling you this because in fact just recently I had some toothache, and so it brought to mind the fact that quite often, I mean this is a very common thing, people have pain which they localize to one or an area of their teeth, of their jaw. Go along to the dentist and you have x-rays and an examination, and the dentist says, oh, I can't find, there's nothing actually wrong with your teeth. And under those circumstances, it's a very rare dentist who will go on and examine your head to look for trigger points that may be referring to your teeth. And I'll just tell you a story, and this was a number of years ago when I was still doing general practice. A patient came to me who actually had spent over $2,000 on having various things done to her teeth from a dentist who was constantly saying, look, I think it's this, and I think we better do this, and then I think we do that. And she had a root canal done, and she had a whole lot of things done. The pain was completely unchanged. She came to see me, and well, we knew that her teeth were fine, and where I went was here on the side of her head. Now, there is a large muscle called the temporalis. It attaches, if you feel, you have almost a circle of a rim of bone that runs like this, and that's where the muscle attaches, and then it runs underneath. There's a bone here which is your cheekbone called the zygoma. It runs underneath that and it attaches into your mandible, and when it contracts it pulls your mouth shut. Powerful muscle. Now the fascinating thing about this muscle is when it gets trigger points, sometimes you feel them locally, but it's not uncommon that it refers to your upper jaw, and in fact it usually refers to 2 or 3 teeth. And depending, because it's quite a large fan-shaped muscle, if the triggers are on the front, it tends to go to the front. If the triggers are there, it tends to go here, and if the triggers are here, it goes to your molars. And it actually refers directly, your brain picks up information from this and it localizes it to these teeth. It is worse when you bite because you're turning on the muscle. And all of that goes together for you to think, oh, it must be my tooth. And so off you go to the dentist, and if you've got a really spot-on dentist, they'll say, look, I can't find a cause. If you've got a fantastic dentist, they'll say, can't find a cause, let's look at your jaw joint, oh, let's look at your temporalis. But that would be one in, I don't know, very rare. But if you have an unscrupulous dentist or an incompetent dentist, you could spend $2,000 or $3,000 having unnecessary work done when all they needed to do was, and how do you do it? You take your finger and you press on the muscle. The muscle fibers run like this, so you're running across the muscle fibers and you're feeling for a little guitar string, which is a tight band. And when you find that little guitar string, you move up and down it until you find, oh my God, that's the spot. And if you press on it and it's really active, the pain appears here. And then you can treat it. That's the best part of it all. And you treat it, well, if you click the link below, that will take you to a clip that will show you how to treat this trigger in a way that makes your pain melt away. Thank you.